Good morning, everyone. As Stephen mentioned, I'm a physical therapist, so if any point during this you want to get up, you want to move your body, I totally support that. I'll be talking about pain today. So big topic about just how big pain is, how big of a problem it is for individuals. Some of the reasons why people with chronic pain aren't necessarily pursuing more conservative treatment options like physical therapy, and then potentially some ways that you could improve the experience for people with pain and how they can really start to treat it. I started my career over on the West Coast. I was born and raised in Southern California. You probably can tell that by the way I talk already. But I work for some large hospital systems, and I've been treating people with pain for several years. So I worked at UCLA Health and Cedars-Sinai, and then I relocated to the East Coast where I worked at Kessler, for those of you who are familiar. And then about 3 years ago, I transitioned to working at Hinge Health. So still treating people with chronic pain, but in the virtual or digital environment. So I'm going to kind of incorporate some of my experience in the clinic, as well as some of the survey results from the State of MSK report. So that is a report that we partner with a third-party research firm on to actually collect data on what people in pain are experiencing with their benefits out in the world. So all of the respondents to this survey have experienced pain in the last 2 years. And so you'll see some of that data weaved throughout the presentation. That's me. All right, so chronic pain. When I talk about pain, there's the bucket of acute pain, kind of like your ankle sprain over the weekend, your shoulder strain that you get because you lifted wrong at the gym, for example. Those are kind of acute injuries. They resolve in a shorter amount of time. If you kind of nip them in the bud right away, they don't become as problematic. And those individuals don't really end up seeking out a ton of different interventions to reduce their symptoms. But when we think about chronic pain, we're thinking about people that have had pain for months to years. And those folks are the ones that start to feel kind of desperate, kind of like, I need some sort of solution. And those are the individuals that end up utilizing opioids for pain relief. So we know that 1 out of every 5 individuals with chronic pain gets prescribed an opioid. And if we really think about filling an opioid prescription, taking a pill every day, unfortunately, it's easier, more convenient, and can be a lot cheaper than finding a PT, driving to that session, committing to the therapy every single week for 4 to 6 weeks. So even though opioids aren't that effective at treating chronic pain, they actually mask the symptoms. They give you short-term pain relief. And then you often need more and more of it to get the same results. That kind of cycle is what leads to misuse of opioids. In addition to the fact that the chronic pain crisis is really driving a lot of opioid use, we also know that pain doesn't really exist in a silo. So if you're experiencing shoulder pain or low back pain or knee pain, it's very, very likely that you're also suffering from some sort of mental health condition as a result of the pain you're experiencing. So I see this a lot with my patients, both in person and virtually, that if you have low back pain, first thing that happens in the morning is you wake up and you're reminded, I have low back pain. You feel it immediately. You try to do something that you like to do, like play golf. You get reminded again, my back hurts. It kind of has this pervasive nature to it, and it makes you feel really stuck. And so we've actually seen in that survey I was alluding to of those 10,000 individuals that about 44% say that their chronic pain has led them to feel more anxious on a day-to-day basis. And then there's also the fact that pain has this effect on medical conditions. So for example, if you're experiencing pain, you might not be able to exercise as much. Your knee pain's getting in the way of that. That can in turn lead to weight gain, which can cause you to, again, not be able to exercise as much because potentially it's causing more pain or more weight onto your joints. So when we think about pain, it's kind of this cycle that you have to try to get out of. Pain worsens anxiety, worsens certain medical conditions, and then those medical conditions worsen your pain. So we have to have some sort of solution that can kind of come in there, break that pain cycle, and help the folks that you're seeing here on the screen that are reporting that they have pain and obesity. They're having pain that's affecting their sleep. And then also, when we think about pain, a lot of times I have patients who will stop doing activities that mean a lot to them. I know I mentioned that a second ago, but there's a particular patient that comes to mind. He played ice hockey his entire life. He played when he was little on club leagues, then in high school, then in college, and he was even sticking with ice hockey well into adulthood in his early 30s. I live in New York City. He played at the rec league at Chelsea Piers, if you're familiar. And then one day he hurt his back at the gym. That pain turned into chronic condition. And eventually he was trying to feel better, looking for solutions, going to get MRIs, all of these things kind of lost in that world. And then eventually was like, I don't want to play ice hockey anymore. I'm really scared that it's going to exacerbate my low back symptoms. And for the first time in like 30 years, he stopped. He put those hockey, what are they called? Skates. I was trying to think of the stick to the side, right? And so, but that had really cascading effects on his mental health. That was his only outlet outside of work. He was only going every Monday to meet up with his friends to play hockey. Now he's not doing that. That leads to isolation. Again, we're seeing 32% of people with chronic pain are depressed or reporting feelings of depression. And all of those numbers are fine and dandy, but it really has impacts on people stating that they're unable to live their life to the fullest. And that also has cascading impacts on their ability to do their jobs at the level that they want. So we're seeing that about 27% indicate that their pain is impacting their productivity in the workplace. And that a good 27% of people have said that they might consider leaving their jobs because of their pain. So affecting personal lives, affecting work lives, and as you all in this room can appreciate, it's costing a lot of money. So a combination of those productivity losses plus the medical claims involved with musculoskeletal issues, those MRIs, the injections, often feeling like you need a solution for your pain, but a lot of those solutions that I just mentioned, like an injection, are short-term. They make you feel better in a very small period of time, but your pain comes back, and then you go back and you go into the system again and try to find another solution for your pain. And that's what's causing this giant number on the screen. It's very expensive, as you guys probably know. And then the productivity aspect actually can cause an even escalated problem to absenteeism. So you'll see that in 2021, the average amount of days that someone missed work because of pain was about 10. That number actually goes up for people who are experiencing pain and mental health conditions to about 14 days a year. So what are people doing for their pain? This is, again, showing all of the different interventions that people are seeking to treat their chronic pain. Unfortunately, it makes me sad as a PT that the tiny little green dot is the PT utilization. And we know from the literature that physical therapy is the first line best practice for treating chronic pain. Not just in the short term, but actually in the long term. But instead, people are taking over-the-counter medications like those ibuprofens, the Advils, that's becoming a daily thing. Again, short-term relief. There's 48% of people that aren't doing anything. They're just saying, yeah, I have pain, I'm not doing anything about it. And unfortunately, what I've seen is that 48% is going to go all the way down to that 20% you see that's getting cortisone injections on the regular, who's starting to look into more invasive techniques. And over to the right-hand side, they're probably going to pursue surgery after all of those little Band-Aids stop working. So why aren't people going to physical therapy? Oh, yeah.
So if you go back to the slide before, you have 39%. Is that opioid medication prescribed by my doctor?
Yeah, not necessarily an opioid, but any type of pain medication that's prescribed. So instead of an over-the-counter like ibuprofen or Advil, it would be potentially some sort of pain relief medication that's prescription strength, but not necessarily an opioid. So that includes both. Yeah, thank you. So why aren't people going to physical therapy? I could read all of these stats, but if anybody here, and you don't have to unless you're comfortable, but if you've been to physical therapy, you know why people aren't going to physical therapy. It is a pain in the butt, right? Like, you have to find the therapist. You have to make the appointment. You might not get an appointment, right? You're waiting a month to get in. You finally go. You're being treated at the same time as somebody else. There's an aide. I love PT aides. I'm a PT. They're my friends. But they're helping you through your exercises. The PT is somewhere running around trying to treat multiple people at the same time. And you have to do that every single week for 6 weeks. And you have to pay a copay every time, right? It's not that pleasant. So it's pretty clear why people are saying it's too expensive. It's hard to stay motivated. It's hard to deal with all the scheduling. These are what the survey respondents said, and these are what most people are experiencing with PT. And then it makes me really sad too, because people will say, PT doesn't work. Well, it doesn't in the way that we're trying to really provide it to people, right? The system is kind of broken. It's not going to be as effective. So another reason why people aren't pursuing physical therapy is just a general lack of understanding around benefits. Now, you guys are the experts in the room on benefits. So this encompasses a lot of different things. So this lack of understanding isn't only specific to musculoskeletal care, but it's part of the problem, right? You don't know what's in network, what's out of network, what's covered, and it leads to this overall confusion about seeking care like physical therapy for your pain. And so, with that being said, when looking into solutions to provide to people who are suffering from chronic pain, who might want to get care for it, whether that be physical therapy or some sort of option for pain reduction, we have at Hinge Health have really looked into some philosophies, some ethos that we think are beneficial when you're looking into a benefit for your employees. And the first one is accessibility. We want it to be either they're able to see a physical therapist maybe outside of regular work hours. Maybe they're able to see a therapist that's closer to their home or from home, a virtual option for them to see a PT. The next is holistic. So I talked about how pain can impact sleep, how pain can impact weight. Pain impacts mental health. So if you are looking into a solution, you want to look at one that isn't just providing exercises for knee pain. Because unfortunately, chronic pain is much more complicated than just exercises for the painful body part. So looking into a solution that looks at the whole person, lifestyle factors, all of those things. The next is personalized. So I have given out so many exercise pieces of paper to my patients in person. Here are your knee exercises. Here are your back exercises. Those were the resources that I had in the clinic, right? And then sometimes I would like X out certain ones. Don't do this one. That one's for that other guy, right? And then that piece of paper gets lost and it doesn't really change. 2 weeks go by, you're doing the same exercises. You don't feel like you're progressing because it's hard to when the exercises aren't challenging you or they're not reduce, getting easier if maybe you have a flare up, for example. So personalization is really important. And that's something that technology is allowing us to do now. It's allowing us, like companies like Hinge Health, to prescribe exercises that will change as you are changing, as you're healing, or maybe you're having a regression. And it's more in real time. Instead of waiting a week to get a new piece of paper that you'll lose or spill coffee on, this will be something maybe you could do from your phone. And then lastly, cost effective. Of course, we want the benefit to be cost effective to the employer and to the employee. Obviously, that's very utopian, but we have to look into how a solution can really leverage technology to potentially make it more cost effective for both of those parties. So that's another thing you have to, of course, consider, which I'm sure you all do. Now, you might be thinking, how can you do physical therapy virtually? Like, it literally has the word physical in it. And there is skepticism involved in that, right? And so we actually were wondering the same thing. Are people skeptical, right? Are people in pain thinking, I'm not sure a virtual solution is even going to be effective? Don't you have to put your hands on me? Don't you have to see me do these movements? Don't you have to manipulate my spine and my joints? But we actually found that 43% of people said they needed PT care that had a digital component. They're actually hungry for something that is maybe more convenient through a digital option. And that 48%, almost half, said that a digital program would make it easier for them to stay motivated, adhere to their care plan, which obviously we know is a big, big struggle or barrier in the traditional in-person environment, right? I always call it my second appointment confessional, where I ask my patient, did you do your exercises? And then they start like looking down at the ground, or me. I did some of them. Which ones? And they're like making up exercise names. People aren't doing their exercises, right? They're like the pony one. So 48% of people are claiming that a digital program will make them be more motivated and adherent. So with that, I just wanted to close out with the fact that chronic pain and the pain experience affects different people in different ways. So you want to also look into a solution that's really going to look at pain for what it is. You can't treat an ankle sprain the exact same way you would treat someone that's had low back pain for 10 years. They need a different approach. So another thing you want to look into when you're looking at a solution is, does the solution consider the type of pain someone's experiencing when it's providing that treatment? Thank you so much for your time. I'm told by this clicker thing that I have 2 minutes if there are any questions, and if not, that's totally fine. Yes?
I noticed the phone on the ground when people are working. Will it work to have it hook up to your TV, or does it only have to be on someone's mobile phone?
So you can use an iPad, a tablet, your phone. I'm pretty sure you can like Chromecast it up to the TV screen. Yeah. Are you worried about like vision related, just ease?
You know, having to look down at a little phone.
Totally.
Having it be up on a big screen might make it easier.
Yeah, absolutely. Yeah, you can. I believe you can cast it. I do have patients. Usually they'll just, instead of using their phone, they'll use like a tablet, like a bigger screen, because we'll provide them a tablet. And then you can also put it like on a desk, so it's more eye level. But that is an option. Yep. Yeah.
Do you see this virtual option as a supplement to the in-person? Because as you mentioned, a lot of times there is some physical manipulation or some, in-person stuff that's necessary in person.
Yeah, thanks.
As a follow-up or a supplement?
That's a good question. So the most annoying answer I would get in PT school to things was, it depends. So I think for some individuals, what I've seen is that it is a good supplement. A lot of times people have gone to in-person, they've gotten the manipulations, they've progressed far enough to where they're in like a maintenance phase. And we are excellent at kind of picking up that care because a lot of that maintenance is exercises and not hands-on. There's also the alternative where someone might come into the program without having gone to in-person PT. And if we were to notice, hey, you would do much better with hands-on treatment, we would guide them to be able to go do that. So it can work in a supplemental, but it can also work very well standalone. So for like chronic pain, which is the most common, it's like 70% of all of the respondents are chronic pain back patients. For low back pain, exercise therapy is like the most effective thing. So yeah, just depends. But I'm out of time, folks. Thanks again so much for your time and attention. Have a great rest of the day.